The broadcast is now starting. All attendees are in listen-only mode.
Thank you so much for joining this co-hosted webinar by Tricerat and Orbis Technologies, Why Efficient Document Management Leads to a Better Clinical Experience. Today we have a great agenda and key takeaways. Our three main topics are going to be how to easily manage large-scale workstation environments and up to millions of documents with the right set of applications. We'll talk about ways to reduce errors, lost data, and gain easier access to information. And finally, we'll touch upon how to increase both administrator and end user productivity with secure, fast, and compliant printing and scanning. And with that, I'll give it away to our panelists.
All right, thank you, Hannah. This is Andrew Parlett. I'm CTO at Tricerat. I've been with Tricerat for about 20 years now, working in product development and now as CTO. And I've worked a lot in the server-based computing and the EUC fields, working with IT admins and building solutions around the enterprise print management space. And over that time, worked with a wide variety of customers, but quite a few of those are in that healthcare space. And so we'll be looking today at some specific needs within there and how print management can help there.
Hi, this is Chris Will. I'm Vice President for Corporate Sales at Orbis Technologies. We are a global content management, software services solutions and analytics company headquartered in Annapolis, Maryland. I have a background in publishing, primarily in textbook publishing and educational publishing. And I've done some work in the healthcare space, publishing curriculum there. Look very much forward to this discussion.
Hello, my name is Erin Lawless Miller. I'm a lawyer and vice president here at Orbis Technologies. My background is in regulatory affairs and clinical trials. I came to Orbis by way of IQVIA, where I ran the rare disease division of the $9.7 billion clinical trial and data analytics company. There, I taught drug developers and clinicians to use their data to their best advantage. Here at Orbis, we have the same goal. We help our clients, and our clinical clients in particular, improve patient outcomes by better utilizing the data information that they already have. I hope our presentation today gives you some insight on how you can use your data to do just that.
Thank you. And to give a little more background on Tricerat and just some background of where we've come from up to today, we were founded in 1997. And around then, we invented the first virtual print driver, along with a protocol that we call TMF. And it was really aimed at solving problems that have existed with remote desktops since the beginning. And now our technology has expanded into full print and scan management for both the remote desktop platforms, but also traditional physical desktops and the mobile environments as well. And our focus has really been on cost savings through simple solutions for our users and solutions that really scale and encompass the broad range of technologies and platforms that are being dealt with. One of the key points that we really focus on is excellent customer service. And one measure of that is a Net Promoter Score of 73, something that we're quite proud of while we work with our range of over 10,000 customers around the globe. And so you see a few here, but this is, our solutions have really been adapted and used in quite a few different environments, as you know, a full and wide range of printing scenarios to go with that.
So as I mentioned before, Orbis Technologies is headquartered in Annapolis, Maryland. We were founded in 2006. And we are really focused on offering comprehensive solutions and services around content management, and not so much even content management. We really treat content as data here, which basically means that we manage content at what we call a component level. And that could be a single word, a paragraph, an image, a video. And our platforms basically track links, versions, and metadata associated with all of those components. So, as a user, you have very granular control of your content. And the benefits to that are numerous. You can create once and publish anywhere, which basically means that once you have that piece of content defined, you can generate products in multiple formats, multiple languages, using a centralized publishing platform. All of this is done via secure access controls, so you can protect your valuable content from insider threats and can control who sees certain content. Our platform integrates with APIs to work with all of your current systems, not to rip and replace them. We have options for artificial intelligence and content analytics, so we can extract and correlate content with machine learning and artificial intelligence algorithms. We can manage a full content lifecycle development process, and we provide services around all of this. Benefits for using our platforms are, include faster time to value. They're easy to integrate, they're flexible, scalable, and very secure, and turns all of your content and the data related activities into repeatable events. We can go to the next slide.
All right, and to kind of step into really the content that we want to discuss today, we have a few questions to pose, and we'll start with this one of how do you manage large-scale workstation environments and up to millions of documents? So certainly when we talk about healthcare, there are a wide range of sizes. There are certainly small ones, but we see a lot of cases where even more than other sectors, we start to see that scale and different levels of management requirements. And so, we're talking about that joint view of print management and also document management. And I'll start a little bit on that print management side. There's a statistic out there that for an average 1,500 bed hospital, that for that average, they print more than 8 million pages per month. And that adds up to about $3.8 million per year. So, that kind of starts to put a little bit perspective to that scale, both in the importance of it, but then also the opportunity for cost savings through refined management and efficiencies. And there's certainly pain points out there in traditional print management. When you think about, the standard ways of, let's just talk like Windows printing, of managing through either manual means of publishing out an Active Directory, or maybe you have complex scripting or GPO solutions that distribute those printers. There are ways in which that works, but when you talk about scale and adding in complexity, problems show up real quick. And so being able to, as we look at scaling these environments, ways, that a print management solution can really drive benefits for administrators and users in that. And so we look at things like having a database backend for that central point of management. And then also that provides ways that we can import settings quickly and easily and efficiently, and really a wide variety of ways to do that. And so that's one of those ways that you can gain centralized management, but then also see those benefits at scale. Christopher, how do we, what are some ways that a content management system might answer this question?
Yeah, I think it's really about understanding and controlling your content or your data. And when you treat content as data, and you can have it be highly searchable, you have metadata associated with it, and you have version controls around it, you have opportunities to really understand and sort of exploit all of that data with dashboards and ways to understand data as around your content. So we solve a lot of pain points around when you talk about printing 8 million documents, that's just a stunning number. But all those documents could be different, and trying to understand, what those differences are, and which user needs to see what document, and which user has access to which document. All those things are things that our platforms, our solutions sort of address, trying to doing things like integrating with third-party AI services and content exploitation services, so you can really understand and dig deep into your content, and really understand what you're dealing with. What is it that you're printing, right? So anyway, Erin, any thoughts on that?
Yeah, I would say that when it comes to dealing with the just the huge scale of documents in any one place, it's all about giving the right access to the right people at the right time. So you're linking up, what is an access level of a nurse versus a doctor versus an administrator, and you're giving that person a dashboard customizable to the information that they need to have at their fingertips at any specific point in their shift.
Yeah, very good. And, I think we can take a look at the second question, which really dovetails with that, what are the best practices for reducing errors, lost data, and to gain easier access to information? And I say these are related because certainly as things scale and as complexity grows, if you don't do something about that, that leads to these kind of errors and lost data that obviously healthcare systems are trying to avoid. And so when we look at management systems, we'll talk again about, from print output side of things, a system that gives user access to the right printer at the right time is really, we're looking to reduce errors through that simple access to resource. And if there's less complexity presented to the user and more, using dynamic assignments and intelligent systems being deployed out to the users, then they have the tools that they need at their disposal, but it's the correct things, and less errors are going to be made and less lost data. Certainly there's an aspect to the data security. You're looking for a software system that does provide those layers of security through protocols like SSL or TLS and all of those things combined. But so much happens just through the complexity of data, and for a print job, it might be printing to the wrong printer, or some other section of the building or somewhere else entirely, and not having full control of when you go to print that document, where it's coming out of, and you have proper access to it. That's certainly one of those big things as far as ways that you can look at these kind of smart printer assignments to reduce lost data and solve some of those security problems, or certainly improve the situation.
Yeah, I think from our perspective, it really comes down to creating that single source of truth around any particular piece of content. So basically, you want to make sure you ensure that with your solution, and basically have the opportunity to enforce best practices around things like role-based access controls, right? So that certain people are allowed to touch that content, other people are not, depending on their role in the organization, the type of authority that they have, and then basically enforcing that level of governance around all of your data, all of your content, using the tools in the environment that are available to you. And then, of course, making sure that that you have ultimate control over, what's literally flushed from the system or deleted from the system, without losing that data, having the opportunity to really review and inspect that. So having that administrative capability around that as well is really crucial.
Yeah, and I certainly, I resonate with that role-based access control and being able to effectively manage who's seeing what. really coincides with the way that printer assignments should work. And just like you're managing views of documents, you're managing even those physical resources as well. And let's go on to that third question, which is looking at workflows. So what workflows can you implement to increase both administrator and end user productivity? And certainly tools should do both. And so from the administrator side, improving productivity to have efficiency gains in managing printers. And going back to the earlier topic of traditional ways of managing printers, as you try to do manual or scripted ways, even through GPOs that can get very complex and hard to view, if a tool that can go into place to be able to automate those things and give easier visibility into that can quickly save time and provide a better IT service. And we've seen healthcare environments have a team of people trying to manage printing through traditional means, and being able to reduce that down to just a minimal number of a few hours a week, handled by, part-time by a person. And so really some efficiency gains for cost savings, but then also being able to apply those hours to other initiatives in the IT environment. And then for users, having a print management system, it should make printing just fade in the background. And so in terms of productivity, printing shouldn't be something that's a hassle and a problem. It should just work. It should just be presented to you in what you need at the right time. And having those dynamic and smart assignments are part of that, but also having a system that can provide self-service to the user so that when they do need to change, maybe it's roaming or maybe it's just a different print resource that they need, have the tools so that they can service themselves quickly and stay productive instead of generating a help desk call, which takes time from both the user and the administrator. Christopher, how about from document side of things?
Yeah, I mean, I think from the document side of things, it comes down to, you have a lot of people that are touching your content. And if you can automate that and control that, and really, manage that appropriately, you can really sort of enforce your regulatory compliance, and make sure that that is far less burdensome to you as an organization because of all the associated reporting and the documentation involved with that type of activity around regulatory compliance. And I also think that another best practice around workflows is being able to appropriately control things like private patient data, again, tied back to that regulatory compliance, so that you're completely HIPAA compliant, for example. This is, one of the things that, an effective content management platform in a healthcare setting can accomplish for you. Also, any of the, so basically making sure that any of the personally identifiable information is is hidden and not going to be affected in your content transformations. Erin, any other thoughts?
No, I mean, I think you hit the key points there, Chris, that in a content management system like this, workflows can be used really importantly to do two main things. Appropriately controlling that, really crucially private patient data, and helping to ensure when you get to those regulatory roadblocks and compliance factors, making sure that all steps have been taken in the right order. It can be a huge tool that you can use to help decrease the burden there.
Certainly, and when we look at workflows, I think that's where we really found ourselves working together into this. Even though one side's document, one side's print, it's a workflow and a comprehensive look at ways that these management systems can provide a full slate of benefits to organizations in being able to effectively and efficiently manage the document process all the way through to print management and using the right printer. And so we do want to dive a little bit more into the different offerings in terms of document management systems and print management systems. We're going to start with the document side, and then we'll have a few slides on the print components as well. Erin?
Yes. So our core message here is that our suite is a data management tool that can be configured to dramatically improve patient outcomes. By using the customizable dashboards and machine learning AI, this tool is something that can be used to harmonize data from various programs, entry points, in a format that makes it easy to extract what is needed when it's needed in that clinical setting. If you want to flip to the next slide, you can see that, as we were talking before about our workflows, can be utilized to appropriately control private patient data and ensure that regulatory compliance hurdles are met. Inspections and reporting requirements become so much easier when the information is accessible and already compiled for when you need it the most. Here, we really provide a competitive advantage in the case of research hospitals and clinical trials in particular, because data collected to comply with and respond to regulatory requirements can be automatically pulled and pre-configured in reports that are ready to be published and submitted to the agency in their preferred formatting using our publishing feature. It saves so much time, which we all know is integral in these critical clinical situations. The next slide, please. So, what does all of this mean for you? In terms of clinical best practices, you can be at the forefront of decentralizing clinical experiences for your patients. When you seamlessly pull data from multiple disparate programs and file structures and documents into dashboards that help your team draw immediate connections. And all of this helps your patients thrive. Our tool supports better patient outcomes by enabling your team to affect real-time change that's supported by your own data. So you're using your data to implement this change. Our tool provides real-time access to the data in digestible reports that help you mitigate risk by detecting anomalies early in time, allowing for real-time solutions. Further, our tool reduces the time needed between clinic and agency with the reporting and publishing features that we discussed earlier. All of this together gives your team the ability to improve patient outcomes and stay on budget, utilizing the combined forces of Orbis and Tricerat tools for best clinical practices.
Thank you. Yes, and to look a little bit at that printing side of things, really looking to address those pain points and the hassles and burdens of managing printing, and especially across different platform types. And to consider dynamically assigning printers to users and devices. We talked about the power of having a database backend to that management system for the central management across the wide variety of platforms, but then to be able to leverage those kind of assignments. And so a management application to link a printer with a user and based on their role in Active Directory, or a device, meaning where they're coming from in terms of a thin client or a workstation that they're using, or even the network they're coming from. So if they're going between different buildings, all of those printers build in their session quickly and dynamically based on who they are and where they're connecting from. That simplicity is a big piece. And so considering, scripts, we've seen environments that have had thousands of lines of script to determine what I was just talking about, where the user is and what device they're coming from, and then what printer to build. To be able to see that in a graphical interface, select the variables that you need, see the printers that are going to be assigned. Having that simplicity from the administrator level not only makes it faster, but does make it more effective because you can see and understand what's happening. And going back to reducing those errors, having that visibility is a strong factor in achieving those goals. And then reducing those help desk calls. And this applies to both a benefit for the user, but also here for the administrator. When the printers build successfully and correctly and printing works, again, it fades in the background and it doesn't become such a burden to the support team and to the IT administration. It happens automatically and effectively based on the platforms that they are and then the services that you're deploying out to those users. And to consider a little bit from the user side, that consistency is a big thing. And so users are connecting in from thin clients or physical desktops, moving around, especially in like a hospital system, they might be going from client to client to client and connecting back into maybe a virtual desktop or some kind of a shared system. And so to have that right printer for me and for my location is a big part of having that productivity capability firsthand, having it there, ready to go, and I know it's going to be consistent and effective no matter what the application that I'm using and where that application is coming from. We talked about having the ability for a self-service component to a print management system. That might be a list of printers that are available to me, or it might be a map where I can visually see where I am. Perhaps it's on a hospital floor or wing, and I can find the printers that I need based on where I am and quickly connect to it, have it available in my session, and have it work, regardless of where my application or my data is coming from. That printing subsystem is consistent across all of those. And so that's really the advantages that we're looking to deliver to a user when you're implementing a third-party print management system, to have that consistent and flexible print interface delivered to them every time. And we've hinted at the fact that this can go across platforms. So, you know, if it's Windows specific or just Citrix or just VMware, there's these certain environments that maybe there's individualized capabilities in those platforms, but a good print management system can span all of that. And it will layer on top of those existing environments. So no matter what delivery platforms you have, whether it's print server printing, direct IP printing, client connected printing, even like printers from home or mobile devices, that can all be layered into the print management system quickly and easily, right into that database and ready to be assigned. And so hybrid environments we look at might be cloud and on-prem combined. It might be VDI and traditional clients. It might be multiple platforms. Maybe there's some Citrix and VMware, but then also looking at like Mac and Linux clients connecting into that, or mobile devices. And then you get complexities with multiple data centers and being able to manage across those different sites, users at different clinic locations or from home use now. All of that can be encapsulated in a print management system to really bring simplicity to those complex environments. And I just wanted to highlight a use case. And so this would be a hospital system that we work with. And they do have a mix of platforms and access types for their applications. So there's thin clients deployed in each exam room that connects to a VDI system. And then there's also published apps to physical desktops. And so doctors and nurses might badge into one system and then walk down the hall and badge to another, which would then connect to or reconnect to that same VDI system. And so print assignments made to those client devices make it so that whoever is using that thin client automatically in their session has the closest network printer available to them immediately in their session when they go to use that application. And because it's database driven, admins can assign hundreds of clients at a time thanks to CSV import. So a whole new hospital wing can come online, and within seconds, they can pull the information into the database and have it ready to go. So someone walks in, uses that terminal, has the right printer, automatically mapped and dynamically for that user. So that wraps up our presentation today as far as print management and document management. Hannah?
Thank you guys so much for joining us on this co-hosted webinar with Tricerat and Orbis. We hope that you got a lot of quick wins and takeaways, starting from the capture, create, manage, and then all the way to printing in your document workflow ecosystem. For those of you that registered before Thursday, the 10th at 1 p.m., we will go ahead and put you in a raffle to win our $150 Amex gift card. We will email you with the results, and thank you so much for joining us today.